Hello everyone, please contact Professor Robert for a sample or a customized paper of the following or any other assignment. NR447, Week 3 Discussion. Procedures and Evidence. Description. Purpose. The purpose of this discussion is for learners to discuss what happens where you work on a care policy is not based on the current EBP research. Course outcome. This discussion enables the student to meet the following course outcome. Code 3. Explain the use of evidence-based practice by leaders and managers. POs 2, 8. Due date. Answer post due by Wednesday 11:59 p.m. Montana in week 3. 2 replies to classmates and/or instructor due by Sunday 11:59 p.m. Montana at the end of week 3. Points possible. 100 points. Directions. Discussions are designed to promote dialogue between faculty and students and their peers. In discussions, students demonstrate understanding of concepts for the week, integrate scholarly resources, engage in meaningful dialogue with classmates, express opinions clearly and logically in a professional manner. Use the rubric on this page as you compose your answers. Discussion. Step 1. Read the following case study. A nurse has an order to complete a procedure on a patient. After reading the procedure, the nurse notices that it is not best practice, and it has not been updated for 6 years. The nurse takes this issue to the nurse leader, charge nurse, and the nurse manager, unit manager. Step 2. Your first post is based on the first letter of your last name. For example, if your last name is Smith, you would answer the nurse manager question. Please review the differences in these roles before posting. The first letter of your last name question to answer. AM. What would you do as a nurse leader if your policy or procedure conflicts with the most recent evidence? Describe your response to this nurse. Why is it important to update policies and procedures? What are the risks if they are outdated? What is your role as a nurse leader in assuring policies or procedures are up to date? And Z. What would you do as a nurse manager if your policy or procedure conflicts with the most recent evidence? Describe your response to this nurse. Why is it important to update policies and procedures? What are the risks if they are outdated? What is your role as a nurse manager in assuring policies or procedures are up to date? Step 3. Reply to classmates in either group. Your discussion post should look like. Paragraph 1. What would you do as a nurse leader or nurse manager, depending on your last name, if your policy or procedure conflicts with the most recent evidence? Describe your response to this nurse. Paragraph 2. Why is it important to update policies and procedures? What are the risks if they are outdated? Paragraph 3. What is your role as a nurse leader or nurse manager, depending on your last name, in assuring policies or procedures are up to date? Resources. Where did you find your data? Thanks for watching.